Hello, everyone. My name is Cassie Bush, and I am the Chief of the Policy and Training Section in the Provider Enrollment Division at the Department of Healthcare Services. I am also joined by Gabe Capote, the Unit Chief of the Policy Unit in PED, and Alex Hernandez, an analyst in the Policy Unit in the Provider Enrollment Division. Thank you for joining us at today's stakeholder hearing. We will be discussing two regulatory provider bulletins related to the Medi-Cal provider enrollment for Qualified Autism Service, QAS, provider organizations, QAS Individuals, and community-based organizations, CBOs, offering behavioral health treatment services. The purpose of today's hearing is to provide you with an opportunity for discussion of these provider bulletins. For our agenda today, we will go over the first draft provider bulletin titled Medi-Cal Enrollment Requirements and Procedures for Qualified Autism Service Provider Organizations and Individuals Offering Behavioral Health Treatment Services. Then we will go over the second draft provider bulletin titled Updated Medi-Cal Enrollment Requirements and Procedures for Community-Based Organizations, Local Health Jurisdictions, and County Children and Families Commissions, which will be amended on May 5th, 2025, for CBO providers offering behavioral health treatment services. Lastly, we will end with comments and questions. Before we begin, I have a few quick reminders. If you are experiencing any technical issues, please send an email to DHCS PED Stakeholder at dhcs.ca.gov for help. Please hold all comments and questions until the end of the presentation. We will have plenty of time for comments and questions at the end. Please be sure to send any questions or comments made in the chat box to everyone. We will discuss this in further detail at the end of the presentation. Only written comments received by email by 5 p.m. today will be considered prior to publication of the final bulletin. You may send your written comments to the following email address: dhcspedstakeholder@dhcs.ca.gov. When submitting your comments, please make sure you reference your name, organization, if you're affiliated with one, and the bulletin title. This hearing will be recorded and posted on our stakeholder hearing information webpage for future reference at a later date. We will provide a link to that webpage in the chat now. Now we will go to Gabe to go over the first draft of the provider bulletin.
Thank you, Cassie. Good morning, everyone. My name is Gabe Capote, and I am the Unit Chief for the Policy Unit in the Provider Enrollment Division. Now we'll go over the first draft provider bulletin titled Medi-Cal Enrollment Requirements and Procedures for Qualified Autism Service Provider Organizations and Individuals Offering Behavioral Health Treatment Services. As a reminder, the draft provider bulletins were attached in the stakeholder hearing invitation email that was sent out on February 28, 2025. They can also be found on our stakeholder hearing information webpage, which we will provide a link in the chat. Now we will go over the bulletin overview. In accordance with Welfare and Institutions Code Section 14043.75b, the DHCS Director is establishing the specific application and enrollment requirements for QAS provider organizations and individuals who apply for enrollment in the Medi-Cal program to reimburse for the covered behavioral health treatment services they provide to Medi-Cal members. These requirements implement and make specific W&I code sections 14043.15 and 14043.26, and as such have the full force and effect of the law. Also, this bulletin does not substitute for or eliminate all other enrollment requirements set forth in W&I code section 14043.26. Effective May 5th, 2025, QAS provider organizations and individuals offering behavioral health treatment services may apply for enrollment in the Medi-Cal program by submitting an electronic application through the Provider Application and Validation for Enrollment online enrollment portal, along with all supporting documentation. QAS applications received between May 5th through June 30th, 2025 will receive an effective date of enrollment of July 1st, 2025, if all other program requirements are met at the time of the submission. All other applications received after June 30th, 2025 will have an effective date of enrollment based on the date their application is received, if all other program requirements are met at the time of the submission. Enrolled QAS organizations and individuals will be able to bill for behavioral health treatment services provided on or after July 1st, 2025 to Medi-Cal members under the age of 21 years who have fee-for-service Medi-Cal. Behavioral health treatment services consist of applied behavioral analysis and other evidence-based behavioral intervention services. These services include behavioral analytic assessment and development of behavioral treatment plans. In addition, behavioral health treatment intervention services are identified in the Behavioral Health Treatment Services chart in the state plan. Behavioral health treatment services must be provided by a QAS provider, QAS professional, or QAS paraprofessional as defined in the state plan. For the purpose of this bulletin, a QAS provider, organization, or individual is defined as the applicant that submits the Medi-Cal application for enrollment to provide behavioral health treatment services. The QAS applicant may be an individual or an entity such as a corporation and must meet all Medi-Cal enrollment requirements as specified in the Medi-Cal Enrollment Requirements and Procedures section of this provider bulletin. Individual board-certified behavioral analysts and educational psychologists may enroll using the QAS application. QAS providers who currently have an enrollment pathway do not need to enroll as a QAS provider to provide and bill for behavioral health treatment. This includes the following provider types: physician and surgeon, psychologist, physical therapist, occupational therapist, licensed marriage and family therapist, licensed clinical social workers, licensed professional clinical counselors, speech language pathologists, audiologists. All QAS applicants must meet current Medi-Cal provider enrollment requirements and standards as well as the requirements set forth in this bulletin, and abide by all state and local laws and ordinances pursuant to California Code of Regulations, Title 22, Section 51000.30E and 51000.60C4. These requirements and standards include, but are not limited to, obtaining the applicable business license when required by local laws and ordinances, and having a national provider identifier as required by the January 2008 Regulatory Provider Bulletin titled Provider Enrollment Application Changes Due to NPI. In these next two slides, we will go over the definition of an administrative location for the purpose of this bulletin. QAS applicants must have at least one administrative location in California, which must be reported on their application. For the purpose of this provider bulletin, an administrative location is defined as the physical location associated with the provider's operations, which can include where services are dispatched or based. The administrative location reported on the application must not be a private residence, virtual box, or mailbox, and may not be reported using a post office box. DHCS recognizes that the actual services may occur at administrative locations, but may also occur solely in community settings, which do not have to be separately enrolled. For the purpose of this provider bulletin, a community setting is defined as a location where the persons employed by or contracted with the provider furnish services outside of their administrative location. For the reported administrative locations, QAS applicants must provide a signed lease agreement, maintain a valid workers' compensation insurance and comprehensive general liability insurance that cover the reported administrative location and operations, have permanently posted signage identifying the name of the QAS applicant and the business hours. The administrative address reported in the application will appear in provider directories and in the California Health and Human Services Open Data Portal. The QAS applicant must report the following information for the individuals providing behavioral health treatment services: NPI, first and last name, any applicable professional license number or certification number, or registration number of the individual. These individuals are not required to separately enroll. QAS provider organizations and individuals referred to as QAS applicants must attest to the following: all QAS providers, QAS professionals, and QAS paraprofessionals reported to DHCS and for whom they will bill meet the qualifications and follow supervision requirements listed in accordance with the state plan for behavioral health treatment services. And they understand that DHCS may audit to verify the QAS provider, QAS professional, and QAS paraprofessional qualifications and the services provided, and the QAS provider organizations or individual must apply documentation upon request of DHCS. This attestation does not supersede any of DHCS authority to audit or request records from the provider pursuant to state and federal law and the provider agreement. Now I'll pass it on to Alex to go over the second draft bulletin.
Thank you, Gabe. Good morning, everyone. My name is Alex Hernandez, and I am an analyst in the policy unit in the Provider Enrollment Division. Now I'll go over the second draft provider bulletin titled Updated Medi-Cal Enrollment Requirements and Procedures for Community-Based Organizations, Local Health Jurisdictions, and County Children and Family Commissions, which will be amended on May 5th, 2025 for CBO providers offering behavioral health treatment services. In accordance with WNI section 14043.75B, the DHCS director is establishing specific application and enrollment requirements for CBOs, local health jurisdictions, and county children and family commissions that apply for enrollment in the Medi-Cal program to be reimbursed for the covered services they provide to Medi-Cal members. These requirements implement and make specific WNI code sections 14043.15 and 14043.26, and as such, have the full force and effect of law. Also, this bulletin does not substitute for or eliminate all other enrollment requirements set forth in WNI code section 14043.26. Effective May 5th, 2025, CBO applicants may enroll to bill for behavioral health treatment services provided by QAS providers, QAS professionals, and QAS paraprofessionals. This option will be available to both first-time CBO applicants and currently enrolled CBO providers submitting a supplemental application. New CBO applications and supplemental applications adding behavioral health treatment services that are received between May 5th through June 30th, 2025 will receive an effective date of enrollment of July 1st, 2025 if all program requirements are met at the time of submission. All other applications received after June 30th, 2025 will have the effective date of enrollment based on the date of their application is received if all program requirements are met at the time of submission. CBOs that enroll for behavioral health treatment will be able to bill for behavioral health services provided on or after July 1st, 2025 to Medi-Cal members under the age of 21 who have fee-for-service Medi-Cal. CBO applicants and currently enrolled CBO providers submitting a supplemental application must meet all Medi-Cal program requirements outlined in the provider bulletin. CBO applicants must report the MPI, first and last name, and any applicable professional license number or certification number or registration number of the individuals providing behavioral health treatment services. These individuals are not required to separately enroll. CBO applicants and currently enrolled CBO providers submitting a supplemental application to add behavioral health treatment services to their enrollment must attest to the following. All QAS providers, QAS professionals, and QAS paraprofessionals for whom they will bill either DHCS or a managed care plan contracted with DHCS for the delivery of behavioral health treatment services provided to members enrolled in Medi-Cal meet the qualifications and follow supervision requirements in accordance with the state plan. The CBO understand that that DHCS may audit the CBO to verify QAS providers, professional and paraprofessional qualifications and the services provided, and that the CBO must supply documentation upon DHCS's request. This attestation does not supersede any of DHCS's authority to audit or request records from the provider pursuant to state and federal law and the provider agreement. Now, I'll pass it back to Cassie for the comments and question portions of the hearing.
Thank you, Alex. Thank you for listening to our presentation about the Medi-Cal provider enrollment for QAS provider organizations, QAS individuals, and CBOs offering behavioral health treatment services. If you would like to share a comment or ask a question, you may either raise your virtual hand or type it in the chat box. Please send any comments or questions made in the chat box to everyone. We will go through the chat box first. Then, if you have your virtual hand raised, we will unmute you individually so you can ask your question verbally.